government to hold their hand in this particular, in every situation, and whenever they get in trouble. So I think that regulation. Regulation will not actually help the automobile industry or the banking industry. I think at this point, if the government were not to do anything, I think they would learn from their lessons. They would try to make more transparency within their industry. They would try to be more fiscally responsible in their industry, and I think it would just actually end up being a better culture in the private enterprise. As far as the consumer goes, I think the consumer has the ability to protect themselves. I know, like we talk about this idea of fine print, and Broad will talk about this idea of fine print being the problem, and that you have to go through 45 pages, just to fill out a credit card or get a loan for a particular house. But I think the heart of the matter wasn't that the consumer, wasn't reading the fine print. I think the problem was that the consumer was making $30,000 a year and putting in an investment on a mortgage that was $500,000. I think the lack of financial responsibility by the consumer and the consumers themselves was the problem to blame for this particular crisis as well. So I think you shouldn't put more regulation. I think that you should take this. Take the ability from banking and the automobile industries to think for themselves. For the automobile industry, I think they should start investing in cars that will last longer, as opposed to Hummers that only get 10 miles per gallon, especially in the situation that we are as far as the oil crisis goes in the Middle East. And I think the consumer should learn from this particular mistake too, and just generally be smarter about the decisions that they make. And I think that the only way for them to learn is if you don't have regulation.
Before I answer, I just want to say hi to Austin Belkin. How you doing? And then to answer the question, should the federal government regulate or manage these industries? And I don't think they should. I think that's a mistake, and I think it's going down a dangerous path. Barack was talking about deregulation causing this crisis that we're currently in. I don't think that's the case at all. I firmly disagree. That, in fact, the deregulation that President Bill Clinton signed into law, which has been largely criticized as the leading cause of the financial crisis, actually has helped our economy more than it has hurt it. I think that what has hurt our economy is the federal government saying, going on what Ryan was saying, that that impoverished people should be buying houses that they cannot afford, and that banks have to be making those loans to them. That's the problem. And if government can stop this cycle of regulating everything in its sight, then we'll help our economy. And in terms of the automobile industry, part of capitalism is the ability to fail. And that means that everything has the ability to fail if they don't work correctly. There's no such thing as too big to fail. That's not America. That's not capitalism. And we need to go back to a system which says that, yes, these firms can fail. The big three automakers can fail, and they should fail if they deserve to. And quite frankly, I was disgusted when President Bush started the bailout process of the automakers, and because it's saying that our economy is not going to be run by the people or the consumers or the suppliers. It's going to be run by the politicians in Washington, who, when a car company wants to move out of Detroit, it's going to say, no, you're not allowed to. We need to go back to a situation where it's run by supply and demand and not by big government.
All right, thank you very much. That was the last question for the economic and social questions. Everybody's been staying under their time, so I think 2 minutes, and I see you've been writing down a lot of notes, so I think 2-minute responses to anything you want to talk about in this category would be appropriate. So,
I'll start, yeah. So let me just start by talking about the stimulus bill. That one of my favorite parts of government is its great transparency and its ability to really keep track of where its money is going. And there's no better example of that than looking at recovery.org. Oh, is it .gov? Oh, okay, sorry. But my favorite thing was looking at Washington State's 99th district, congressional district, and seeing how many jobs were created or saved in this 99th district. I guess that would mean that in the state of Washington there would be about 101 congressmen. No, but obviously I'm being sarcastic, and there is no 99th district in New Jersey or any state, and the government has completely failed in this regard. I read an article on the Wall Street Journal about this one small businessman who's claimed to have saved or created like 500 jobs, with getting a few $1,000s from the government, part of the stimulus bill, and he looked himself up on the internet, and he saw that it actually said that he created like 5,000 jobs, and he was thinking, I didn't do that, what are they talking about? But what it is, these numbers that they're getting, the people who get the money are filling out some form saying, how many jobs would you estimate that you created or saved? And they're saying, I guess I did this many jobs, and here's what I did, and then you send it in, and then the government says that you live in the 99th district of the state of Washington, and you've created 5,000 jobs, when really, you haven't created any jobs. You haven't saved any jobs. We've been losing jobs in this economy. And the unemployment rate is up to 10%. And we were told by our president, by our vice president, by the entire administration, by Larry Summers, by all of them, that it was not going to go above 8%, and now it's at 10%. And we need some accountability for that. And they need to come out and say that they were wrong, and that if the stimulus bill has failed, and that, quite frankly, I would like my $787 billion back, and I'm waiting for my bailout and my stimulus bill personally, because I'm a little broke. That's all.
You want to go? Okay. So I just wanted to address the three things. I wanted to address healthcare, the bailout, and essentially the federal government regulation. First, I wanted to talk about the healthcare issue and the idea of the public choice. And I want to put out this metaphor. Would you ever let the umpires union of the Major League Baseball buy the Boston Red Sox? I think the answer is no, because when the Red Sox were to actually play a game, that would mean that the umpires would be biased towards regulating or umpiring that game. And I think it's important that the government doesn't get their hands in the actual healthcare industry, in the actual game, because that will allow them to be biased regulators in the healthcare industry. And that's what I was talking about when I was saying that you're going to put that the government will put higher standards on the health employers and the hospitals, and they will essentially give them less money for these particular services, in which the healthcare industry would actually have to offset it to the private industry, and thus effectively creating phasing out the private industries because they can't create a sustainable base. Secondly, I want to talk about what Barack talked about, how the increasing GDP and that the bailout has actually been creating jobs. I just wanted to question that in a sense that how many of these jobs are actually being sustainable? There's a lot of projects that are being created. You have the energy bill a lot of energy projects that are being passed through, a lot of construction projects that are being through. But when these projects are actually completed, where will all of these jobs go? And I think right now we're seeing the effects of a lot of jobs being created. But in the long term, as far as sustainability, I'm not really sure that these jobs will actually hold up in the long run, because you're not creating a system where these private industries, where people will actually be able to have a job after the crisis is over. And I'll hold off on answering the last one.
Okay. I do agree with Noah. The recovery.gov website is bullshit. Don't go there. The website I'm talking about is look at the CBO, Congressional Budget Office. That's the nonpartisan research organization for Congress. They have reported that 1.6 million jobs have been created so far, and they use macroeconomic analysis for this. I don't want to go too much into detail, but that's the whole issue with that. And the other thing is, I want to talk about healthcare mostly. And they say that the government would run private insurers out of business. By the best estimates, the CBO says that only 6% of the public would go into the public option. Best estimates. And the cost concern is basically because of three things: because of fraud, because of preventative care, and because of first contact doctors, what's called primary physicians. So if you have preventative care, if you see your doctor earlier, if you get treated earlier, you don't have to have long run costs. If you get diagnosed with cancer earlier, you don't have to pay too much for that in the long run. So these are the things that the healthcare bill addresses. That's how costs come down. It's not you can't just simply say that you're bringing more people into the process and costs have to go up. It's not as simple as that. It's talking about long-term costs, 20 to 30 years. And the other thing is that even though total costs, when you bring more people in, go up, the per capita cost goes down because you're spreading the risk among a lot of people. So you're reducing the cost that every single person has to pay for their healthcare every year. And he talked about opening up competitions to state lines. Well, I have no use buying a health policy from North Dakota if they can't cover my colonoscopy if I'm 50 years old. If there's no regulation, if there's no consumer protection for healthcare, buying across state lines is useless. I can't buy a North Dakota policy plan if I'm 50 years old and North Dakota does not mandate coverage for colonoscopy or mammograms.
Sounds like
So these are